Good evening, my name is Madison Gompert, and I will be informing my peers how to perform CPR. There are 6 steps of how to perform CPR. First, you need to check the scene for safety. Second, check the victim for responsiveness. Third, call 911. Fourth, turn the victim into the right position. Fifth, perform chest compressions and breaths. And finally, sixth, continue the chest compressions and breaths until medical personnel arrive. Hopefully, after learning the 6 steps from my speech, you will then know how to perform CPR. Okay. Step number 1. You're going to check the scene for safety. Anything around the victim needs to be moved so that they won't potentially hurt themselves more, or you could trip over them and then hurt yourself, and you would be no use for them. So we're going to move anything around the victim far enough away so that it doesn't cause any problems. Second, we need to check the victim for responsiveness. This can either be done from the tap, shout, tap method, like so. Are you okay? Are you okay? And after that, you should then move on to checking for their breath. You need to put your ear next to their mouth and nose and watch their chest rise and fall, or not rise and fall in this condition. Then you need to check their wrist for a pulse. You can take their wrist, pull back their sleeves or anything on it, put 2 fingers right over underneath the heel of their hand. You're going to hold it there for about 10 seconds or until you can tell that there isn't a pulse. Fourth, you need to make sure that the victim is in the right position. We need them to lay flat on their back, which she already is, but we need to move them so that they're completely straight and their limbs aren't flailing everywhere. Fifth, you need to perform 30 chest compressions and 2 rescue breaths. This can be done by taking your dominant hand and putting your non-dominant hand over it like so. You're going to take the heel of your hand and put it on the sternum of your victim, right in the middle. After this, you need to push down. You need to go make sure that you are fully over the patient and that your elbows are locked. This will help make the most force go down on the victim. To complete 1 compression, you need to push down at least 2 inches. This will help their heartbeat. You need to do this 30 times. And a way to remember the pace is to sing the song Staying Alive, either out loud or in your head. Now, 2 rescue breaths are performed after 30 chest compressions. You will pinch the victim's nose, lift their head back a little bit, and use your thumb to open their jaw. After this, you will take your whole mouth and go over their whole mouth, which, for my sister, I will not be doing that. She won't like that. I'll open it. You'll put 1 breath, which should be for about 1 second, and you need to make sure that the head is tilted back far enough that the chest will rise. After this, you need to do 1 more. And at all, if you can't get any breaths to go into your patient, you need to, instead of doing more breaths to try to get more air into their lungs, you should go back to chest compressions just to keep their heart beating. Step number 6, continue doing the 30 chest compressions and 2 rescue breaths until EMTs arrive at the scene. This could be a very long time, so it helps if you have someone with you, because then you can switch off in between to take a break so you don't get as tired, and every single chest compression is the same it's the same as the one before, making sure that they have the best chance at staying alive. Okay. In conclusion, the purpose of my speech was to inform my peers how to successfully perform CPR. First, we went over the scene safety. Second, the responsiveness of the victim. Third, how to call 911. Fourth, what position the victim should be in. Fifth, how many chest compressions and breaths to give. And finally, how long to do these chest compressions and breaths, which is, again, until EMTs arrive at the scene. Hopefully, after learning these 6 steps, you have a better understanding of how to perform CPR. Thank you for listening.